It's recording.
Okay, so last time I was here doing a presentation, I talked about physical stresses, like when we're lifting up a patient. We're going to feel physical stress on our back and our legs, and how to do that properly so that we don't feel that stress. So this week I wanted to talk to you about our mental and behavioral stresses that we're going to feel when we're on the job, and maybe even outside of the job. So first I have a question for you guys. Why did you want to be an EMT or paramedic?
To help out the community bystanders and know what to do in emergency situations.
Cool. Val?
What you said.
No help. Andrew?
Because I'm here a lot.
Because you're a firefighter.
Yeah.
Okay. So alright. So like you said, we are EMTs and medics because we want to serve our community. It's very rewarding. We want to help people in their most emergent times when it's their emergency, not ours. We're the ones with the straight heads, and we can care for them as best as we can. It's also mentally stimulating. You get dispatched for moose versus vehicle, and that could be anything. Dispatch could say, all right, you're going out to a vehicle, there's a moose on the side of the road. You get there, there's no moose, and there's a vehicle that hit a guardrail. You could go out there, moose is on the other side of the road, and patient is standing up, right, fine, not complaining of anything. Or you get the moose and the car hood, or car top is rolled back, and there's a dead person in the back. It could really be anything out there, and I find that to be really mentally stimulating, because as soon as you get that call, you're already thinking about possibly the worst case scenario, or what it may be, even though dispatch is telling you something different. And of course, I think most of us are adrenaline junkies. We love that rush of needing to do something quickly, lights and sirens. We just get really ramped up. And sometimes we don't even get that dose of adrenaline at all. Living here in Delta, we don't have a call every single day. And all of this really comes at a price. This is all really stressful if you think about it. Next slide, please. So when the tones go off, we feel the primary arousal. We have a sense of readiness, and we become alert. And so we start focusing on what we need to do. When we're driving, we focus on other drivers, the sides of the roads, looking for moose, making sure that we get there all safely and on time. And we may or may not feel a secondary arousal, and that is maybe in a more traumatic situation where we get kind of focused in on our skills and taking care of this patient. So our vision narrows, our fine and complex motor skills might become, I guess, discombobulated just for a second. We might forget how to do a skill, or putting the IO needle together might become difficult just for a split second until we get our bearings back. And we may also have memory distortion, where we go and write the report and we might not remember everything that happened because we are so focused on the patient and maybe not other things that were around us. So there's 4 types of stresses. Survival stress is that life-threatening situation where either our life is in danger or a patient's life is in danger. If we're in a traumatic situation where it's really affecting us, we might develop post-traumatic stress disorder. And that's something that I would encourage you guys to read up on, and I can go over that in further detail with you later. And then there's secondary traumatic stress disorder, which is something I had never heard of. It's called compassion fatigue. And so we get patients and they're telling us about all their aches and pains, everything that's gone wrong with them in their entire lives. We've got 2 hours of it on our way to Fairbanks. And we are the ones that actually get fatigued because we're giving out this empathy and compassion, and nobody's asking us how we feel. So, and then there's internally generated stress, where we're anxious about something, we're constantly worried, it's just kind of all in our heads, and we become maybe self-critical of how we're doing, and we basically become our worst enemies. Next is our environmental and job stresses. Here we have to balance work life, home life. It's week on, week off. That's a long time to be away from your families. We might have limited supplies here because of back orders from our suppliers, or the ambulance issues, like switching from 185 to 182 to 185. And next we're going to have the fatigue and overworked. You might have 3 calls in one day. That's 15 hours on the ambulance. That's going to be a long day. Longer shifts than normal. And then there's the small town. There's not a whole lot to do here, and you're kind of stuck in the station, especially in winter. There's pretty much nothing. So, okay. And now I have a video to show you how we might be able to manage these stresses.
Psychological effects of stress can be just as serious as the physical effects. And I think many people are not aware of how stressed they are and how it can impact their life negatively. Now, there's some stressful situations that I think are quite obvious, such as death of a loved one, a life-threatening illness, or a divorce. But there's others that are maybe less common, such as problems at work, or problems at home, problems with your marriage, or financial problems that kind of creep up on you as time goes on. And stress over time can cause irritability, anxiety, agitation, depression. The less common effects that I think people forget about are problems with concentration, trouble making decisions, constant worry, or loss of sense of humor. So I think the psychological effects need to be taken just as seriously as the physical effects of stress. Psychological problems can spill over to physical problems because when you're stressed, your muscles can become tense, and it's not uncommon to have headaches, back pain, or neck pain. Also, stress affects how fast food may move throughout your body, so it's not uncommon for patients to tell me that they have an upset stomach, or they're having diarrhea, or perhaps constipation. Also, they grind their teeth more, or clench their jaw, and have poor sleep patterns. And as we know, poor sleep patterns can lead to other physical complaints. Lastly, many people who are stressed don't make the best decisions, and these poor decisions can affect negatively on their body. Stress can affect your behavior because stress can trigger changes in your body that make you more likely to get sick or make the problems you already have worse. Other risk factors such as obesity, high blood pressure, or high cholesterol can come into play because many people who are stressed eat more, they exercise less, they smoke, and they smoke more than they used to. Also, unfortunately, many people start abusing alcohol or drugs as an easy escape, and over time this may cause more problems in the future. I think the first step in getting stress under control is learning about the root of the problem. Is it your home life? Is it your work? Is it finances? And once you've learned about that stress and what the root of the problem is, you have to realize you may not be able to eliminate it, but you may be able to manage the problem better in the future. And once you've learned about your stressor and how to minimize your reaction to it, you react with physical complaints, emotional complaints, or do you have behavioral changes, you may learn how to respond better and deal with that stress better in the future.
Okay, so that's kind of what stress looks like. I know I said that I was going to be talking about how to manage stress, but first we had to look at what stress actually does to your body. Okay, can you do the next slide, please? So how do we manage our stress? First and foremost, when I get asked, well, what's your job? I'm like, well, I'm the operations manager. And what I really tell people is that I'm here for you guys. I'm here to make sure that you guys have the support you need to be able to do your job. So I hope that you know that you can trust me, I pass no judgments on you, and I want to do the best for you. So if you ever feel burnt out, like you, Val, on your 23-day shift, we can find a substitute for you if you need a day off. I encourage you to get as much sleep as possible. 7 to 8 hours is the recommended time. If you're trying to go to sleep, make sure that you maybe turn off your telephones, turn off the TV 2 hours prior, just to become destimulated. You might be able to fall asleep better. Also, keeping hydrated. Maybe use the restroom every 90 minutes. That's how you know you're hydrated. If you're not, it can cause secondary physical issues on your body. A fitness program 3 to 4 times a week. Val, you've come up with a great solution. We don't have much in the bay right now, so you've taken up a pack, go up and down the stairs. I think that's really awesome. But we do have the treadmill outside and some weights that we can use too. And then I think the biggest thing is probably eating healthy. It's hard to eat healthy when you're in EMS. You're maybe sometimes on the go too much. but we can still make smart choices. So I wanted to tell you that cortisol is that stress hormone, and when that gets released, insulin is released as well, causing cravings for those complex carbs and sugars. So we tend to want to eat breads and potatoes, French fries, candies. So in place of those, it would be better to eat foods such as dark-colored fruits, sweet potato fries, making instead of spaghetti, do a brown rice spaghetti with fresh tomatoes, excuse me, and other vegetables. Also, when we are sleep deprived, we may have a chemical release of galantin, and that's when we're wanting to crave fatty foods. So we tend to want to eat popcorn, fast food, frozen foods. So we might want to bring trail mix, have that with us when we're going out on calls just to snack on. Smoothies, protein bars, Val, you've been kind of making those yourselves lately. And also maybe some oatmeal or chicken and vegetables. So that's for stress, and again, I'm always here for you guys. So thank you.
Thank you.
Thank you.
Okay.